Hi, this is Dr. Shaina Rozell. I am a hematologist oncologist with Affiliated Oncology out of Chicago, Illinois. Today, we'll be discussing metastatic breast cancer. This is MD Newsline. So what factors do I determine for a high risk of recurrence in patients who are hormone positive, HER2 negative breast cancer? So when I'm discussing these factors with a patient, most of these are how large is the tumor, whether there is lymph node involvement, whether there is a high Ki-67, which tells you how fast is that tumor growing. I also look at my genomic risk factors such as mammoprint or oncotype. That tells me again what the patient's risk of recurrence is. When I'm determining the risk of recurrence and the hormone status, looking at, for instance, if the estrogen is high and the progesterone is low, they also give me a better information or better tool in determining whether the patient has a higher risk of recurrence. What is our current understanding of the biology of breast cancer and its mechanisms of reoccurrence? Breast cancer behaves differently, and everyone is different. What we know is that patients, for instance, can harbor these mutations. So they may develop mutations, and the question is, why is a patient on an endocrine therapy for 5 years and then all of a sudden the patient progresses? Or 20 years later, the patient has been doing great and then all of a sudden they have indolent disease and now they actually have a new breast cancer. There is, for instance, a new test developed called breast cancer index testing that tells you again, what is their risk of recurrence down the line? So we're talking about 10 to 20 years and whether or not they actually need additional endocrine therapy. And so even in those patients, if they have higher risk, they're on not just endocrine therapy for 5 years, which has previously been the only standard of care, but now they're on it for an additional 5 years, so a total of 10 years. So what we are learning is that some of these patients, they have indolent disease. Some of these patients, again, are harboring these mutations that may develop, these pathways develop, such as the CDK4/6 cycle, where these cancers are learning how to escape the traditional pathway and develop resistance and of course, cause recurrence. So what is the typical spread of metastatic breast cancer? So when I'm counseling my patients from day one, when they're entering the door and we talk about breast cancer, we talk about the different types of breast cancer. We talk about how breast cancer spreads. So typically breast cancer spreads to either lungs, liver, bone, and brain. And those are the more common ways that they actually spread. And so with the treatment strategies, it really depends on the site of spread, the site of metastatic disease. If there is brain metastases, for instance, I'm looking for different ways to target that brain metastases. I'm also using maybe a combination of radiation. I'm looking for drugs that actually can penetrate the blood-brain barrier. For patients who have lung disease or liver disease, it really depends on, one, the volume of disease. You're looking for, again, medications that can actually, what we call treat aggressive visceral metastases. If it's bone-only disease, I also treat that differently. So it depends on the site of metastatic disease and also the number or the involvement of metastatic disease.